Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Wednesday, April 7th. I would like to remind our listeners before we begin that these COVID-19 updates will look slightly different over the coming weeks during the election period. Dr. Hanley will provide any case updates and will focus in on technical aspects of COVID. He'll also use the opportunity to respond to questions that we may receive about the week's pre-identified topics. Sign language interpretation is being provided by Mary Thiessen. French language translation services is not available this week. The Q&A format will remain the same. We will call reporters by name, and each will have 2 questions. Before we begin, I would like to verify that everyone can hear us. If any of the reporters are having a problem, please email ecoinfo@yukon.ca. Dr. Hanley?
Thank you, Pat. Good morning. Bonjour tout le monde. Last week, we indicated we would be talking about testing for COVID-19 this week, but I have deferred that to a later time. Instead, given the situation in Canada, I wanted to focus more attention on variants and vaccine progress. First, let me say that we have no new cases of COVID-19 identified in Yukon. The 2 recently announced cases have both been confirmed to have the B.1.1.7 variant, and I can tell you that both individuals are now recovered, so we have no active cases. I want also to say right off the top that I acknowledge that many people are asking about when we can open up now that vaccination rates are high. I received a letter just last evening saying that Yukoners have done their part and we need some tangible rewards. I want to say that I completely agree and that my team and I are working through some considerations for the next government. To be clear, I'm not in a position to announce changes in measures during this period unless changes were to be made urgently, such as in a COVID surge. We are using this time to put together all the ingredients that will feed into the best public health advice that we can provide to a new government. I do think that the timing works well, not just because we are still actively implementing the vaccine campaign and encouraging all adult Yukoners to get vaccinated, but we're also carefully assessing the risk of variants in Canada, which quite profoundly influences our susceptibility to outbreaks in Yukon. I will therefore focus attention for this briefing on a variant and a vaccine update. Now, unless you are completely off-grid over the Easter weekend, you will likely be aware that several jurisdictions introduced significant restrictions, either just prior to the long weekend or during, or in fact, expecting more restrictions in Ontario today. I have to tell you, I continue to be grateful to be in Yukon, not only for our low levels of case activity and the modest degree of normalcy throughout these past months, but most importantly, I'm grateful for our community that has stuck together in a time of crisis. With a variety of restrictive measures continuing in a number of provinces, case numbers rapidly picking up and variants of concern sweeping through certain areas, it has become a race against time for many jurisdictions. In this race, the new virus tactic is variant COVID. On our side of the battle, we have at least 2 key weapons: the ability to apply public health measures which we know are effective, and we have vaccine. As we watch much of Canada, and for that matter, most of the states and many parts of Europe, Asia, and Africa, you can see that most jurisdictions are attempting to apply the right measures of restriction according to actual or anticipated spread of COVID and burden on the healthcare system. It is clear from watching around the country that there is debate about how strict and how long the lockdowns or circuit breakers should be. The difficulty is in getting the right balance, especially after months of varying degrees of restrictions. And it's all the more challenging with variants of concern as they are more transmissible, more severe, and affect younger people. The B.1.1.7 variant is about to dominate in many areas, and now P1 as well is behind outbreaks in several parts of the country, particularly in BC and Alberta. I wanted to take a few moments to review some key features that we're learning about these variants in the last couple of weeks. Variants and vaccines are both game changers, although in opposite directions. Variants are driving the worsening trends we are seeing around the world, while vaccines are still our ticket out of this pandemic. So we cannot talk about next steps and lifting measures without being very conscious of the risks that COVID-19 brings to Yukon. Variants are doing exactly what they were predicted to do, perhaps even more so. They are increasing rapidly, and that affects our susceptibility to a VOC, or variant of concern, making its way here and leading to rapid spread. Are enough of us vaccinated to prevent this? Not yet. We have made great progress overall, but the uptake has slowed, and we have almost half of our younger adults still susceptible. So what do variants of concern do that we're worried about? Well, at least 4 key things. They spread more easily from one person to another. It is now clear that they cause more severe illness. They have much more affinity for younger people. And they can reinfect people previously infected with COVID, and some variants may be more resistant to vaccine. Put these features together, and you have the situation we are seeing down south. Many young people affected through contact in social settings, unusually high numbers of people getting seriously ill and ending up in ICU. The enhanced ability for variants to spread means that the virus typically affects everyone within a closed, shared space. Households, restaurants, bars, and workplaces are some of the settings where these variant outbreaks are occurring. All 3 of the current variants of concern are therefore more transmissible than traditional or previous COVID. P1, which is responsible for ongoing outbreaks in BC and Alberta, is rapidly transmissible and, as happened in Brazil, has an ability to reinfect people who previously had COVID-19 infection. The P1 variant is definitely a threat we are very concerned about at the moment. We can be confident that our current vaccines are effective against the B117 variant, which so far is dominating over the other VOCs. The evidence on the P1 variant is not clear enough to say as yet how effective the current vaccines will be against its spread. Remember that vaccine is not our only weapon, just our newest. Public health measures continue to work well against these variants, and where breakthrough infection occurs, we then must rely on accessible testing and skilled contact tracing. It is so important to test early and test often when any symptoms occur. That is how we will limit the damage that variants could cause. So our best strategy against these variants is adherence to public health measures we know for now, and increasing our protection from vaccination, as many Yukoners as we can reach. While the rest of the country grapples with the rise of new variants and a definite third wave, it of course has been quite different for us here in Yukon. I know that at this point many are anxious to move on and just open up. But I think most recognize that we have been able to maintain an environment here where our measures have allowed us to avoid the surges that most of the rest of the country have had to live through, along with the lockdowns that have had to be imposed in response. Early on in the pandemic, just over a year ago, we assessed and recommended as rapidly as possible those public health measures we felt would best protect Yukoners from COVID-19. Our goal was to contain the infection to sporadic introductions and to limit the spread as much as possible. The containment approach, relying on testing and case identification, rapid and thorough contact tracing, while introducing the Safe 6+1, have together created our success so far as a territory. Our success has also been in part because of Yukoners being receptive and supportive, taking social responsibility and truly embracing the public health measures we have in place. I know the ebbs and flows of this pandemic have caused some levels of distress, but I'm heartened to see the number of people who are continuing to take public health measures seriously. With our current public health measures, we have been able to sustain sufficient measures that have reduced our importation risk, interrupted the possible spread and ultimately maintained a strong control of COVID-19. As a result, we are not in the same position as other jurisdictions. We have been able to contain rapid spread, prevent large outbreaks, and community spread because of the adherence of Yukoners to the Safe 6+1, along with the 14-day self-isolation period upon return to Yukon from anywhere outside our borders. Had measures not been followed so vigilantly, we would not be where we are now. Part of planning for any pandemic, and planning during a pandemic, is looking to the future, anticipating what may come next and how we can respond to it as the pandemic shifts and changes. Our COVID-19 response unit team has been doing just that, and we have resurgence plans in place should we need to take more drastic steps. Of course, no one wants to go there, but if we have to, we are ready. If we are tired, and who isn't, and let down our guard, we are putting ourselves at risk. I get how tired everyone is of hearing about COVID-19, of having to wear a mask, of not being able to hug friends and family, not even seeing family and always having to remember to wash our hands. Not a bad thing, that last one after all. It's hard, especially with the endless winter days, not to plan a vacation in the sun or travel at will. It's hard not to be able to walk into a long-term care facility or the hospital anytime you want to visit a loved one. We're all tired. But we have to face the reality that we are not through this yet. I think we are getting close, but Canada and most of the world has a rough period to go through first, and we can't be completely insulated from that harsh reality. There are 3 vaccine goals: Yukon, Canada, and the rest of the world. And to be truly secure, we need all of those populations well vaccinated. As of the end of the day yesterday, 23,414 Yukoners had received their first dose of vaccine, 12,136 their second dose. Vaccine teams are again back in rural communities this week and into next week, providing both first and second doses to those community residents who want them. To review our uptake figures by age, they have moved slightly in the younger populations, but not fast enough, in my opinion. So looking at by age categories as of April 3rd, 18 to 29, 52%. First dose uptake. In the 30 to 39 age group, 63% moved up from 61%. In the 40 to 49 age group, 69% first dose uptake, and that's moved up from 67%. In the 50 to 59 age group, 71%, moved up by 1% in the last week. Similarly, 60 to 69 has moved up to 79% from 78% last week. You doing okay?
We're good.
Yeah. Okay. And in the 70 plus, staying at 87%. Our overall estimated uptake for the Yukon population, and this is uptake of the eligible population, the adult population, is 68%. Now, we have talked about 75% of eligible Yukoners vaccinated as some approximation to give us overall protection as a community. Again, we don't know the exact number. There are so many variables in play. As a physician and as the person responsible for public health of all Yukon residents, I would like to see that number reach even higher, especially among certain populations, such as our elderly and vulnerable. For the time being, we continue to work to vaccinate all those who want to be vaccinated and continue to answer questions, engage with people, and provide information to those who are more unsure about the vaccine. Again, I think we can be optimistic about relaxing restrictions as vaccine uptake increases, as warmer weather approaches, and if we can get to the other side of this third wave and variant surge. No matter how much ice and snow we have now, spring and summer will get here, and so will the end to this pandemic. We're all looking forward to enjoying the Yukon summer and even to rediscovering places beyond. Let's stick together for the next few weeks, keep up with the vaccinations, and I promise we will get there. Thank you. Gonestish, merci, Cho. Merci.
Thank you, Dr. Hanley. We'll now go to the phone lines, and we'll start with Luke from CKRW.
Hi, Dr. Hanley. I was just wondering if you could confirm. So the Yukon resident that had acquired the B117 variant has recovered, and the person that was out of territory has also recovered. Is that correct?
Yes, Luke, that's correct.
Next question, Luke.
Should I have?
To Stephanie, Yukon News.
I have no questions. Thank you.
Thank you. Philippe, CBC.
Yes, thank you. We've seen there's some organizing of a protest this weekend against COVID restrictions. What would be your message to those people specifically?
Well, I guess it's, reflecting on the last few words, I may just, to hang in there and to stick with us. And we know it's by sticking together that we have done well. I know that I'm not going to convince everyone that that's the case. I think also that people have to be careful of where they get information from. And there is a lot of misleading information. There's very misleading information about vaccine and vaccine effectiveness. There's misleading information about lab testing and reliability of lab tests. There's misinformation about perceptions of whether the pandemic exists or not, and there are various conspiracy theories, and I think all of these can play on people's minds, especially when people are stressed, and especially when we are in a situation where information is changing all the time and evidence is accumulating from day to day and week to week, and sometimes we have to adjust and tweak our messages, and sometimes we have to change what we have been saying. So I think that all plays into some people's skepticism and distrust. And I think all I can do is do what I can to let people know what's going on, what my opinion is of this situation based on the best information and evidence. And if you're looking for your own information, which you should, just be skeptical and look for those authoritative and reliable sources of information.
Thank you. Philippe, do you have a follow-up?
I simply would ask as well, when people book a second shot, is there a danger in booking too early there? And is that an issue if people don't wait the 4 weeks?
Thank you, Philippe. That's a great question. There is... For the Moderna shot, the recommended interval, as you know, is a minimum, is a 28-day recommendation, and then we have extended that to a window of 42 days or 6 weeks within our context. And as you know, NACI confirmed today a comfort with up to a 4-month interval. But there is a danger, as with any vaccine, of going too early with the second dose. The danger being that you may not get the boosting effect to the same degree because you haven't had time for that first priming effect to occur. So the minimum interval for Moderna by the manufacturer is 21 days. We really try to steer people to 28 days. Sometimes there have been some exceptional circumstances where it made more sense to go, say, at 25 or 26 days rather than waiting for an uncertain second dose because of people's travel itineraries or circumstances like that. So my message is that much better later than earlier. And I would far rather someone receive their second dose at 3 months rather than 3 weeks, and especially no earlier than 3 weeks. So we really have, and we've even actively encouraged people who have mistakenly booked before 28 days to come back and rebook if at all possible for a later interval.
Thank you. We'll move to Mario, Radio-Canada.
Hi, yeah. Sorry, hi. Our question is actually for, and I'll ask it in English, but if you can, Dr. Hanley, you should say a word in French as well on this. You can answer it in English, and then maybe just a quick word in French. We got this question from readers. People are wondering, and I know you're still working on measures that you'll recommend to the next government, but would you be open to letting fully vaccinated residents re-enter the territory without the 14 days isolation, but with, the testing and then only isolation until the results from the test? Is that something that you're open to?
Yeah, thanks, Mario. It's a really good question, and it is a question that's on the table. And so we're actually, I won't say what the answer is because I don't know what the answer is at this point. I think there are. There are different possibilities and options that have been looked at, around the world or within the country by the federal expert groups here. So we are definitely looking at what the options and alternatives might be, and whether having differential approaches for vaccinated versus unvaccinated makes sense. So definitely more to come in that, and we are. Right now, that's one of the areas that we are taking a very close look at. Donc, je vais peut-être répéter. La question, c'était en ce qui concerne la quarantaine, si on peut avoir dans le futur une approche différente pour ceux qui sont vaccinés vis-à-vis ceux qui ne sont pas vaccinés, si on va rendre plus courte la duration de quarantaine, ajouter des tests, etc. Donc, on ne sait pas encore la réponse, mais on est en train d'examiner des approches, des options pour présenter pour la prochaine gouvernement, pour le futur. Donc, quand les conditions sont bonnes, sont acceptables, on anticipe qu'on va avoir les recommandations dans cette pour les possibilités pour la quarantaine.
Thank you. Mario, do you have another question?
Yeah, just as a follow-up to the whole, with the elections and everything, what will the process be when we have the new government in place? Like, how fast do you want to act on, the work that you guys are saying that you're doing right now to come up with these recommendations? How will that process look like? Like, are you in a hurry to get new stuff out, or?
Yeah, of course, I won't speak in detail to the political process, but because that will play out as it must, but of course, it will take some time for swearing in of the new government. So the caretaker mode will continue for some time after that, depending on the due process to take place. I think people want to know. I think where I feel not in a hurry to make changes, but I think people need to know what we will be recommending and what the timetable will be for those changes. So I think that's where I would like to get information out as soon as practical. So clearly people want to know what the future is ahead of us. even though right at the moment we may not be in the best time anyway for making radical changes just because of the surge of variants that I've been talking about. Donc c'est peut-être pas le moment pour faire des changements, des gros changements pour le moment avec les mesures publiques, mais on est conscient que la public veut savoir qu'est-ce qui sont les changements possibles pour le futur, pour le printemps, pour l'été. Qu'est-ce qu'on a pour rembourser notre effort avec vaccination et avec avoir suivi toutes les mesures jusqu'au maintenant. Donc, on reconnaît que la public veut savoir et on va travailler avec le nouveau gouvernement pour donner les options le tout possible. Et donc, on retourne pour le gouvernement pour avoir la chance de parler avec le public, avec les recommandations.
Thank you. We'll move now to Tim, Whitehorse Star.
Yes, good morning. All right. My first question is whether we can get any updated information as to the current vaccine, the Moderna one. Is it going to require, a couple of doses a year or something every year? Is there any new information on that? And also how well it will handle any potential outbreak of some of these variants if they arrive here?
Thanks, Tim. So we don't know the duration. I mean, we so far recognizing that with new vaccines, that question always has to come with time, and we are, I think, pretty confident that for 6 months and more, that the vaccine is durable. I think it's going to be durable for longer, based on the robustness of the immune response and the high degree of efficacy. But we have to see that play out with time in the real world. So I'm optimistic that it will be durable, but what does that mean? Does it mean a year? Does it mean 2 years? We just don't know that yet. I would anticipate that boosters will be needed, and the advantage, of course, with the mRNA vaccines is that they can the booster might be different because it might be adjusted to variants, which is partly an answer to your second question. Or your part B of your first question, maybe I should say. But what we know about the B117 variant is that that appears that the mRNA vaccines are a good match for the B117 variant. So we would be quite confident, and that's one of the reasons, again, for pushing highly vaccinated population, is that even against the most common variant right now, what's likely to be the dominant variant, B117, the vaccine shows good protection. We don't know as much against P1. It would likely be at least partially protective. But if we did see a vaccine-resistant variant emerge, and I think, given the global situation, that is quite likely at some point, then we would have to look forward to a booster that would be adapted to that vaccine, to that variant, I should say.
Thank you. Do you have a final question, Tim?
Just I think Dr. Hanley's touched on it for the most part, but so we shouldn't expect to or have much hope of seeing the end of this vaccine rollout anytime soon. It may be a kind of quasi-permanent thing.
Yes. So, I mean, I see this first effort, as the initial rollout, of course, to get everyone their first and second doses, hopefully close to everyone. The next part of that really will be getting our children immunized when the vaccine becomes available for children. And then I think we will have, just like as I said before, I expect that we will be living with COVID for years to come. I think all indications are that it will become an endemic infection. I think just as it will be with us for years to come, I think we will have it will be added to the armamentarium of regular vaccines, both for children and for adults. I think that is the likely future.
Thank you. I'd like to thank everyone for their time today and advise that the next COVID-19 update will be Wednesday, April 14th at 10:30 a.m. Next week's technical topic, barring any changes, will be based on requirements for self-isolation, why we need to self-isolate, the importation risk, and what self-isolation might look like in the future, along with any updated info on vaccine and variants. If you have any questions you'd like to see answered, please email hss@yukon.ca or post a question to the HSS Facebook site.